Hello, my name is Hector Barreiro, and I'm going to present our work, Path Routing Optimization for STM Ultrasound Rendering. Ultrasound haptic devices offer new forms of interaction. Each ultrasound transducer can be controlled independently, and the aggregate pressure waves produce a tactile sensation in midair without holding or wearing a device. However, controlling the transducers directly to produce a desired sensation is challenging. Instead, we can describe a tactile sensation using a small number of focal points. Two common methods work by controlling focal points: amplitude modulation and spatiotemporal modulation. STM provides some advantages over EM, such as larger coverage and intensity. However, commanding the device is harder, as it requires to specify the paths that produce the desired percept. In this work, we studied the problem of rendering interaction with virtual environments using STM. Previous work simplified this problem by displaying the contact locations and ignoring the forces at those contacts. In contrast, we believe that the display can be richer if it considers the force field produced by the interaction. The challenge is, how do we map force fields to STM paths? We introduced ProSTM, the first method to render an arbitrary force field using STM. Given a target pressure field, we optimize a set of focal point loops that produce the best matching pressure distribution. Our method accounts for several perceptual and technical constraints. First, we move focal points at a speed that favors constructive interference in the skin, and in this way we maximize the perceived intensity. Second, we limit the loop length to ensure that the stimulus is perceived as continuous. Third, we assume that during a time window, the stimulus is perceived as persistent. This simplifies the design of our algorithm, as we can rule out the temporal component of STM. With these constraints in mind, we define our algorithm in two steps. Given an input target pressure field, we first perform a coarse initialization step, which downscales the input field and produces an initial set of loops. Then, we perform a refinement step that optimizes the path to maximize the intensity and coverage while satisfying the constraints. The resulting paths produce the best matching quasi-static pressure field. We applied our method to the rendering of gaseous media and perform a comparison with our previous method based in AM. We have validated that our new method provides larger and smoother coverage. In particular, we have observed that AM can suffer ambiguities when rendering large stimuli. We carried out a user study, which demonstrates that our new STM method helps to discriminate such cases. If you own a Stratos ultrasound device, we encourage you to try our method. It is available for download on our website. Thank you.